let's spend a little time talking about Medicare and how Medicare coordinates with UC medical plans. We'll also talk about UC's policies around Medicare because Medicare is extremely valuable. For the unfamiliar, Medicare is the federal health insurance program for those 65 or older, and you can become eligible for Medicare before age 65 if you are stricken with certain diagnoses like Lou Gehrig's disease or permanent kidney failure. You can also qualify for Medicare through end-stage renal disease, even before you're age 65. Now, there are multiple parts of Medicare. Medicare Part A is the part of Medicare that pays for facility fees when you're in a hospital or skilled nursing facility. Part A is known as hospital insurance, and it's premium free for most people. If you paid into Social Security for at least 10 years, or if you married somebody who paid into Social Security for at least 10 years, you will likely pay nothing for Medicare Part A. Medicare Part B, the medical insurance part of Medicare, pays for things like physician fees in and out of the hospital, emergency room fees, durable medical equipment, imaging, lab work, pretty much everything outpatient that isn't drugs. Medicare Part B is not free. I don't have 2026 rates yet. They have not been announced as of the recording of this presentation. But in 2025, the standard Medicare Part B premium is $185 a month. Now, if you are in the top 7% of earners in the United States, Social Security might charge you more for Medicare. And they always use 2-year-old tax information. So in 2025, you would think about your 2023 adjusted gross income. In 2026, you look at your 2024 adjusted gross. Technically, they look at your modified adjusted gross income. It's really your AGI plus tax-exempt interest income, if you have any, from 2 years ago. So based on 2025, the premium is $185 a month more if your MAGI is above $106,000 for those filing singly, and $212,000 for those married filing jointly. As I said, Medicare is very valuable, so UC has several requirements around Medicare for retirees. UC has no rules around Medicare for active employees. If you're an active employee and you've found your way into this retiree presentation, understand that I'm not talking about you. I'm talking about retirees. If you are a retiree, you must enroll in Medicare Part B if you are enrolled in medical insurance through UC. If you can get Medicare Part A for free, we don't require you to pay for Part A if you cannot get it for free. And if you live in the United States, I mean, there are exceptions for people who don't live in the US. If you live outside the United States, Medicare won't pay, and we won't require you to pay for Medicare if you have a home address outside the United States. Know that if you ever come back to the US, you will have to enroll in Medicare if you are eligible. And if you did not enroll in Medicare and pay Medicare Part B premiums from age 65 on, there's a chance that you might have to pay late enrollment penalties if you don't pay for Medicare Part B, even though you live outside the United States. So for those who live outside the United States who turn 65, you have to think about something. Do you want to pay for Medicare Part B, even though it's useless to you outside the United States, just in case you come back to the US and need to enroll in it so that you don't pay late enrollment penalties? Or do you simply not enroll in Medicare Part B and pay the late enrollment penalties when you come back? That's an individual decision based on your circumstances. If you need to talk about it, consult with me, consult with Nick. We deal with these things all the time. I mean, you turn 65 once, but we deal with Medicare every day. So let us help you think about these things. Now, another exception is for those who retired prior to July 1st, 1991. You're not technically required to enroll in Medicare. But for everybody else, if A is free, you must have B if you're a retiree, okay? Failure to comply with UC's Medicare requirements may result in the loss of UC coverage And to get your attention, UC will start penalizing you a $420-ish penalty for failure to comply with UC's Medicare policies. So it's serious business and it's worth serious money. So consult with us if you have any questions about this. In my opinion, Medicare plans for UC retirees are better than any active employee plan. Don't get me wrong, they don't cover GLP-1 weight loss medications, and Medicare is very fussy about preventive care. When you have Medicare, you have 12 months to get a welcome to Medicare physical exam, for example. After the first 12 months, you can't get a comprehensive preventive physical exam out of Medicare. Instead, you can get annual wellness screenings, but they are not as comprehensive. So there are some limitations with Medicare, but generally the plans are richer and cost you less than if you did not have Medicare or were an active employee. So it's very, very valuable. But there are two ways to coordinate Medicare with health plans. You can't just have Medicare by itself. As valuable as it is not comprehensive enough. Everybody needs something to go along with Medicare so that they don't go broke paying for medical care, because Medicare is a foundation. It is not comprehensive coverage. There are two ways to do this. You can either keep your Medicare or you can give it away. If you keep your Medicare, then you have original Medicare Parts A and B paying first. Then you get a supplemental plan. Out in the real world, or if you were covered through VIA benefits, which we'll talk about, you'd get a Medigap plan as a supplemental plan. And then you'd also have Medicare Part D as in drugs on the side. We'll talk about Medicare Part D later. But the idea here is that you can either keep your Medicare and have original Medicare paying first, or you can give your Medicare away. You can sign over your Medicare benefits that you've paid so many taxes for to a private insurance company. That's known as a Medicare Advantage arrangement. The biggest advantage to keeping your Medicare and having Medicare pay first is that when Medicare pays first, Medicare offers more doctors than any private insurance, and that's because Medicare rarely requires prior authorization. If you sign over your Medicare benefits to a private company, if you choose a Medicare Advantage plan, that Advantage plan can impose prior authorization requirements on all kinds of things. Well, remember that there are two ways to coordinate with Medicare. You can either keep your Medicare or you can give it away. If you're in a UC PPO plan, when you coordinate with Medicare, you'll enroll in one of the Anthem Blue Cross plans that serve as Medicare supplements. When you have a Medicare supplement plan, that means that Medicare pays first, the supplement plan pays second. And our Medicare supplement plans are through Anthem Blue Cross. They are called UC Medicare PPO and UC High Option. When you have one of these plans, you keep your Medicare, which means you have maximum access to doctors, and your doctors rarely have to get prior authorization to treat you. That's because, as I understand it, Medicare only requires prior authorization for certain infusions and maybe a power wheelchair, at least in California. So you have a situation where the doctors who are treating you are the ones who control your health care, not some panel of doctors at a private insurance company who have never seen you, who get to rule on whether you are covered or not. So you have a lot of flexibility with this kind of coverage. Medicare pays first, Blue Cross pays second, you pay third if anything, but of course that means that you must use Medicare providers. Fortunately, around 99% of U.S. doctors contract with Medicare. The 1% of U.S. doctors that have opted out of Medicare, ignoring pediatricians, it's generally psychiatrists. And UC knows that. So UC adds special benefits to our Medicare plans, our Medicare PPO plans, for behavioral health providers who have opted out of Medicare. Okay, so behavioral health is special. But generally, if you are getting regular medical care, you can't use a doctor who's opted out of Medicare, because then Medicare won't pay. And if Medicare won't pay, Anthem won't pay either, unless, again, it's a behavioral health provider. Now, fortunately, since most doctors are part of Medicare, it's easy to stay with Medicare providers, and you can find Medicare providers on Medicare.gov. Now, of the U.S. doctors who are part of Medicare, the vast majority take whatever Medicare allows as payment in full. And they don't balance bill you, meaning they don't charge you. They cannot charge you above what Medicare allows as payment in full. About 96% of U.S. physicians cannot balance bill. They participate in Medicare. But there's about 3%, 2 or 3% of U.S. doctors who are part of Medicare. They contract with Medicare, but they don't accept assignment. That means that they reserve the right to charge up to 15% over what Medicare would normally allow. So if you happen upon one of these rare doctors that does charge the extra 15%, you would be responsible for that 15%. Fortunately, I have had almost no complaints about this over the decades because so few doctors do it, and the 15% isn't a lot of money. Again, when you have Medicare and an Anthem Blue Cross plan, because Medicare is your primary and Anthem Blue Cross is secondary, prior authorization is rarely required. Now, the other way to coordinate Medicare, besides keeping your Medicare, you can give your Medicare away. If you sign over your Medicare benefits to a private insurance company, that's called Medicare Advantage, and UC offers 2 Medicare Advantage plans. So this is how we coordinate Medicare with our HMOs. So if you have Kaiser and you get Medicare, we enroll you in what's called Kaiser Senior Advantage. If you have HealthNet, the UC Blue and Gold HMO, the Medicare version of that plan is a Medicare Advantage plan called UC Medicare Choice through United Healthcare. Of course, we're going to talk more about all of these plans as we go along. But for now, know that when you have an Advantage plan, you're really going to use the plan's ID card. You're really not going to use that Medicare card, except maybe for free bus rides in Hawaii or whatever other discounts you can get with a Medicare card. You really won't use the Medicare card because you're going to use the plan's card because Medicare is paying the plan to cover you. Medicare pays a flat monthly fee to the insurance company and expects that insurance company to pay your claims. Medicare then washes their hands of you. Now, don't get me wrong. I want you to carry your Medicare card with your Medicare Advantage ID card in your wallet, just in case you ever end up in an emergency room. ER intake people are going to want to see both cards, but just tell them to bill either Kaiser or United Healthcare, depending on the plan you have, rather than Medicare, because Medicare cannot be used separately from the plan. There might be exceptions for hospice and cancer clinical trials, but for everything else, you're going to use the private insurance company, the Medicare Advantage plan, Kaiser or UC Medicare Choice. Now, Medicare Advantage plans, I should say, are free to require prior authorization, and that is why some Medicare doctors will not accept Medicare Advantage plans. Now, in the Davis-Sacramento area, most of the major chains are going to be available to you through the UC Medicare Choice plan, for example. It's only some smaller specialty practices that won't take this Advantage plan. Of course, if you choose Kaiser, you essentially cut yourself off from most doctors, hospitals, and pharmacies because when you have Kaiser, you can only go to Kaiser providers. And that's true even when you have Medicare. You can't just go to any Medicare provider when you have Kaiser. When you have Kaiser Senior Advantage, you got to use the Permanente doctors. But more on Kaiser later. Earlier, we talked about Medicare Part A, hospital insurance, and Medicare Part B as in boy, medical insurance. Now we're going to talk about Medicare Part D, D as in drugs, which is the outpatient prescription drug benefit under Medicare. You might be wondering, what about Medicare Part C? You might have heard about Medicare Part C as in cat. I don't use the term Medicare Part C because it makes it sound like people are missing something if they don't have Part C, but you don't have to have an Advantage plan, of course. So I don't use the term Part C, but Part C is another term for Medicare Advantage. Now, I don't use the term. I prefer the term Medicare Advantage because I think it's more clear what you have. But everybody's going to have Medicare Parts A, B, and D with few exceptions through UC's retiree package. And if you have Medicare Part D, the outpatient drug under Medicare, outpatient drug benefit, you're going to know it because you'll see on your ID card this symbol. This Medicare RX symbol tells the pharmacy that Medicare is subsidizing your drug coverage, because that's exactly what Medicare Part D as in drugs does. Medicare pays a plan to cover you for drugs when you have Medicare Part D. And of course, you have drug coverage through almost all of our plans, so you will have Medicare Part D through almost all of our plans. Now, when you first enroll in a Part D plan, usually when you turn 65 after you've retired, or when you retire, if you retire past age 65, Nick Robledo and I will help you sign up for your Medicare plans, and we'll sign you up for your Medicare Part D plan if needed. For example, let's say you have Medicare and an Anthem Blue Cross PPO plan, like UC Medicare PPO or UC High Option. With those plans, you have Anthem paying second after Medicare Parts A and B for your medical care. But separately, you will actually have a company called Navitus as your pharmacy benefit manager. And Navitus is prepaid by Medicare to cover you for drugs. Navitus is your Part D plan. And you'll actually have a separate ID card from Navitus that says Medicare RX on it because they are your Part D plan. But even if you have Kaiser or United Healthcare, you will also see this symbol indicating that Medicare is subsidizing your drug coverage. Now, because Medicare is subsidizing your drug coverage through Medicare Part D, that complicates matters, okay? It complicates matters because Medicare will not pay twice to cover any one person for drugs, which means that you cannot have two Medicare Part D as in drugs plans at the same time. And in fact, if you have a UC Medicare plan that includes drug coverage, and then you fall for the sales pitch of some insurance broker, and you sign up for a non-UC Medicare Part D drug plan, Medicare will stop paying your UC Part D plan, and generally UC Part D plans are superior to plans that you could buy as an individual person. So that would be bad, right? Don't enroll in non-UC Part D plans unless you know exactly what you are doing. Now, there are situations where you might want to do that. For example, let's say you're eligible for coverage through UC, through Medicare, but also through a third source, like maybe you're married to somebody who retired from the state of California and can cover you through CalPERS, or maybe you're retired military, or you're married to retired military, and you can qualify for TRICARE for life. Well, for those with triple coverage through UC, Medicare, and a third source like CalPERS or TRICARE for life, maybe federal benefits, maybe something like that, we can enroll you in a very special plan called the UC Medicare PPO without prescription drugs. In order for us to enroll you in this plan, you cannot enroll in a Medicare Advantage plan outside UC. You can't choose a PERS Medicare Advantage plan. It's going to have to be PERS Gold or PERS Platinum. Those are Medicare supplement plans, and supplement plans are okay. So if you have PERS Gold or PERS Platinum, or you have TRICARE for life, you might want to consult with Nick Robledo or I on setting up triple coverage during open enrollment through the UC Medicare PPO without prescription drugs. Because that plan does not cover prescription drugs, it's cheaper. And because it's cheaper, you might get Medicare Part B reimbursement from UC as a credit on your UC pension check, yet still be triple covered by Medicare and two other plans. It could be pretty sweet to have this triple coverage, but it is complex, so do consult with us if you're in this situation. Most of you are going to have Medicare Part D through UC. Now, I have alluded to it earlier in the presentation, but now let me make it very clear. UC's non-Medicare medical plans have Medicare versions, Medicare counterparts. We call them Medicare partner plans. Now, there is an exception to this, and that is the UC Health Savings Plan this year, the Health Savings Plus Plan next year, 2026. Those are plans that are not compatible with Medicare at all, and they don't have partner plans. But for all the other plans, there's a Medicare version, okay? On your left, we have the non-Medicare plans, UC Blue and Gold HMO, which is a Health Net plan. The Medicare version, if you will, the Medicare Partner Plan, is UC Medicare Choice, which is not an HMO. It's a PPO that lets you go to any Medicare provider. And it's also not through Health Net, it's through United Healthcare. So it's quite an upgrade from an HMO when you get Medicare if you're in the UC Blue and Gold HMO. So the Medicare version of Health Net is United Healthcare. That means that if you turn 65 and you have Health Net, you're going to go to this United Healthcare plan, UC Medicare Choice. But it also means that if you're in a mixed Medicare family, meaning that some covered family members don't have Medicare and some covered family members do, then your family might have Health Net and United Healthcare at the same time. So I know it's weird, but this is how it works. If you're covering family members and anybody in the family who's covered has Medicare and you have Health Net, then they're going to have UC Medicare Choice, United Healthcare. Or if you're the older one with Medicare and you're covering younger family members, you might have UC Medicare Choice, but your non-Medicare family members might have UC Blue and Gold HMO, Health Net. That's how it works. I call it mixed Medicare families. Similarly, the Medicare version of Kaiser is Kaiser Senior Advantage. So a mixed Medicare family might have family members with regular Kaiser that we call commercial Kaiser. Those with Medicare would have Kaiser Senior Advantage. Now, those of you who have UC Care, the Medicare version, the Medicare Partner Plan to UC Care is called UC Medicare PPO, a Medicare supplement plan through Anthem Blue Cross. Now, as we've talked about, we're going from Blue Cross to Blue Shield for our non-Medicare medical plans. That means that if you're in a mixed Medicare family, the non-Medicare family members might have UC Care and they would have Blue Shield of California, whereas Medicare family members have the UC Medicare PPO and they have Anthem Blue Cross. You might have a mixed Medicare family with both Blue Cross and Blue Shield family members in it. In California, Blue Cross and Blue Shield are separate companies, so that's how it works. Now, I want to point out that if you're somebody who in 2025 has CORE and the UC Medicare PPO, remember, CORE is being eliminated and replaced by the Health Savings Plus plan. Unfortunately, Health Savings Plus is not compatible with Medicare because it has an HSA. We'll talk more about that later. That means that if you have a mixed Medicare family with CORE and the UC Medicare PPO right now, next year, all the non-Medicare family members in CORE will be automatically transferred to UC Care. So you're going to want to become a lot more familiar with UC Care because it's going to cost you more and have a higher out-of-pocket maximum than CORE does. But as you will see, it also has its own strengths, such as a lower deductible and low flat copayments for prescription drugs compared to CORE. So there's more to talk about, which we will get to. But for now, understand that you can have these Medicare partner plans that determine what Medicare plan you will have once you become eligible for Medicare. And you can also have mixed Medicare families in these situations. That is, unless you move outside California. UC has special benefits for retirees who change their home address to something that's outside California, and when all covered family members have Medicare and are at least age 65. Okay, so this does not apply to people in mixed Medicare families, but if you change your home address to something that's outside California, even though we have plans that would cover you outside California when you have Medicare, we won't let you keep them. Instead, we're going to send you to a giant insurance broker called Via Benefits. Via Benefits will sell you local Medigap and Medicare Part D plans or Medicare Advantage plans if you reside in any other state outside California. Now, for this to apply to you, all covered family members have to have Medicare and be at least age 65. So if one of you is disabled and has Medicare prior to age 65, Via Benefits would not apply to you until they turn 65. Everybody has to be 65 or older and have Medicare for you to be sent to VIA benefits. Now understand that going to VIA benefits does not affect your dental, vision, or legal coverage. It only affects your medical plan. You'll still have the same dental, vision, legal that you had before, most likely. The way it works with VIA benefits is this. If UC sends you to VIA benefits, we're sending you to this broker that's going to sell you local Medicare plans, but we're going to help you pay for them by providing you with money in the form of a health reimbursement arrangement, an HRA account. We don't just add this money to your pension check, because if we did, it would be taxable. Instead, VIA benefits will keep track of this money for you. This HRA money you can use to reimburse yourself for what you pay for premiums for Medicare, Part B, Part D, for your Medigap plan or your Medicare Advantage plan premiums. Or if you have money left over after you paid all these premiums, you can also use it for eligible healthcare expenses like dental work. But most of that money, if not all of it, is going to go towards premiums. Now, the amount that UC will provide each January is $4,000 per covered person, assuming you get 100% of the UC contribution. If you are subject to graduated eligibility and you get only, let's say, 50%, you'd only get $2,000, okay? But this is a greater amount than in past years. In past years, UC has been providing $3,000 maximum per covered person each January. Congratulations if you're out of state. This is going up by $1,000 to $4,000 per covered person each January if you get 100% of the UC contribution. In that example, let's say it's you and your spouse and you live in Vermont or something and you have your coverage through VIA benefits. Your HRA deposit in January is going to go up to $8,000 for the two of you. That's going to go a long way towards covering your premiums. Again, it's subject to graduated eligibility. If you don't get 100% of the UC contribution, you're not going to get the whole $4,000. Also, if you join VIA benefits mid-year because you move out of state mid-year, you're also going to get a prorated amount, not the full amount. Now, if you do move out of state, Nick Robledo and I help people with the transition to VIA benefits all the time. Lean on us. Let us help you get started. Let us paint the picture for you. Let us help you with the paperwork that's required to get you to VIA benefits. But you'll work with VIA benefits to pick those individual policies, and you'll also work with VIA benefits to reimburse yourself from the HRA money in hopefully an automated a way as possible for all those premiums. So VIA benefits will control that HRA money. Now, I do want to warn you, when you are covered by UC medical plans because you have a home address inside California, our custom Medicare plans have no pre-existing conditions exclusions. Not so when you live in the real world. And VIA benefits coverage is real world coverage, which means that Medigap plans will have pre-existing conditions exclusions that make them impossible for you to get to if you choose a Medicare Advantage plan, or maybe if you're trying to go from Medicare Advantage to Medigap, you might have to pay high risk premiums because of your pre-existing conditions. So it's a little more risky to choose a Medicare Advantage plan when you're covered through VIA benefits, because you might not be able to upgrade from Medicare Advantage to Medicare supplement coverage because of pre-existing conditions that you never had to deal with when you were covered by UC plans. Studies show that when people are trying to go from Medicare Advantage to Medigap, it's because they're sick. And if you're sick, you have pre-existing conditions. So, be warned, be careful. VIA benefits will tell you more about this, but I hope I've painted the general picture for you. Now, that's the end of the Medicare section of this presentation. Next, let's get into the HMOs.